Support for the Journal of Clinical Oncology podcast is provided in part by AstraZeneca, dedicated to advancing options and providing hope for people living with cancer. More information at AstraZeneca-US.com.
Hello and welcome to the JCO Article Insights. I'm your host, Ejah Kelly, and today we will be discussing the Journal of Clinical Oncology article, the deruxtecan versus docetaxel for previously treated advanced or metastatic non-small cell lung cancer, the randomized open-label phase 3 TROPION-Lung01 study. Despite significant advances in non-small cell lung cancer treatment over the past decades, second-line treatment options for non-small cell lung cancer without actionable genomic alterations have remained largely unchanged since 2000. Many clinical trials failed to demonstrate improved overall survival compared to docetaxel-based regimens. TROPION-Lung01 is a global, open-label, randomized phase 3 trial comparing the efficacy and safety of Dato-DXd to docetaxel in patients with previously treated advanced or metastatic non-small cell lung cancer. Dato-DXd is an antibody-drug conjugate targeting TROP2 and delivering deruxtecan, a DNA topoisomerase 1 inhibitor, as its payload. The trial is designed with dual primary endpoints of progression-free survival as assessed by blinded independent central review and overall survival. The initial PFS results were presented at the ESMO in 2023, and this article reports more detailed data and overall survival analysis of the trial. In the TROPION-Lung01, 299 patients were randomly assigned to receive Dato-DXd and 305 patients to receive docetaxel. Patients were stratified by the presence of actionable genomic alterations, histology, treatment with PD-1, PD-L1 immunotherapy as the last line of therapy, and geographical region. The baseline characteristics of the patient population were overall balanced between the treatment arms. I'd like to highlight a couple of key points here. The median age was 63 years in the Dato-DXd and 64 years in the docetaxel arm. Similar to the many clinical trials in the thoracic oncology field, this is younger than the median age of lung cancer diagnosis in the US, which is around 70. African American and Hispanic patients were underrepresented in this trial, with the 41% of patients identifying themselves as white and 39% as Asian. The docetaxel arm had a slightly higher percentage of male patients, 69% versus 61%. The majority of the trial population, 73%, had adenocarcinoma. Patients with actionable genomic alterations were included in this trial if they received one or more targeted therapy and platinum-based chemotherapy prior to the enrollment. 17% of the trial population had an actionable genomic alteration in this trial. When it comes to the efficacy results, in the full analysis set, the PFS improvement was statistically significant. The median PFS was reported as 4.4 months for the Dato-DXd and 3.7 months for the docetaxel arm, with the hazard ratio of 0.75 and a p-value of 0.004. However, after a median follow-up of 23 months, the trial did not meet its primary endpoint of overall survival. The median overall survival was 12.9 months for patients treated with Dato-DXd and 11.8 months for patients treated with docetaxel, with the hazard ratio of 0.94 and a p-value of 0.53. Objective response was a secondary endpoint, and the confirmed objective response rate was 26% with Dato-DXd and 13% with docetaxel. Now, let's take a closer look at some of the subgroup analyses. Exploratory analyses of key subgroups in TROPION-Lung01 demonstrated differences in efficacy based on histology. In the non-squamous subgroup, Dato-DXd showed a longer progression-free survival of 5.5 months compared to 3.6 months with docetaxel, with a hazard ratio of 0.84. However, in the squamous subgroup, Dato-DXd performed worse, with a progression-free survival of 2.8 months compared to 3.9 months with docetaxel, corresponding to a hazard ratio of 1.32. A similar trend was observed in the overall survival analyses, though confidence intervals crossed 1 in both histology subsets in this case. The differences observed were not statistically significant. In the non-squamous subset, the median overall survival was 14.6 months with Dato-DXd and 12.3 months with docetaxel with a hazard ratio of 0.84. In the squamous subset, both arms had shorter survival compared to the non-squamous subset. The median overall survival with Dato-DXd was almost 2 months shorter, 7.6 months, compared to 9.6 months with docetaxel, corresponding to a hazard ratio of 1.32. While these analyses suggest the potential survival benefit for Dato-DXd in non-squamous subset, this trial was not powered to test this hypothesis. Hence, these analyses remain exploratory. Another subgroup analysis of note was the group with actionable genomic alterations. Patients with actionable genomic alterations achieved a median PFS of 5.7 months with Dato-DXd and 2.6 months with docetaxel, corresponding to a hazard ratio of 0.35. Similarly, the median overall survival was longer in patients with actionable genomic alterations by almost 6 months, with a median overall survival of 15.6 months with Dato-DXd and 9.8 months with docetaxel, corresponding to a hazard ratio of 0.65. Now let's talk about safety. Grade 3 or higher treatment-related adverse events occurred in 26% of patients with Dato-DXd and 42% with docetaxel. The most common adverse event of any grade seen in the Dato-DXd arm were stomatitis, seen in 47% of patients, nausea in 34%, and alopecia in 32%. Treatment-related interstitial lung disease occurred in 8.8% of patients on Dato-DXd and 4.1% of patients on docetaxel. Of note, grade 5 drug-related ILD was more frequent with Dato-DXd. 7 patients on Dato-DXd and 1 patient on docetaxel died secondary to drug-related ILD in this trial. In summary, TROPION-Lung01 aims to address an unmet need for patients with previously treated non-small cell lung cancer. For this population, the treatment options remain limited with poor survival outcomes. TROPION-Lung01 is a positive trial by design due to clinically modest improvement in PFS. However, the lack of overall survival improvement is disappointing. Exploratory subgroup analyses suggest Dato-DXd may offer a survival advantage in specific subsets, such as non-squamous non-small cell lung cancer and patients with actionable genomic alterations. However, these findings require further validation in a prospective trial, since TROPION-Lung01 was not designed to address these questions. The data from this trial alone is not sufficient to argue for a change in clinical practice. However, it informs how the future trials using this drug should be tailored. This highlights the importance of studying potential predictive biomarkers earlier in the drug development and incorporating these biomarkers prospectively into the clinical trial designs. Due to the lack of overall survival benefit in this trial, the biologic license application for accelerated approval of Dato-DXd for patients with previously treated non-squamous non-small cell lung cancer was voluntarily withdrawn. New BLA was submitted for Dato-DXd for patients with previously treated advanced EGFR-positive non-small cell lung cancer. This BLA is based on data from TROPION-Lung05, TROPION-Lung01, and TROPION-PanTumor01. Of note, the results of TROPION-Lung05 trial have been just published in JCO. This wraps up today's episode. Thank you for listening to JCO Article Insights. Please come back for more interviews and article summaries, and be sure to leave us a rating and review so others can find our show. For more podcasts and episodes from ASCO, please visit asco.org/podcasts.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.